We're going to go ahead and get started with the next portion of our event. So, good afternoon, everyone, and welcome to the Medical Innovation Exchange. Thank you so much for being here and celebrating with us today. Your support means everything to us. For those who I haven't had the chance to meet yet, my name is Armen Bakirtzian, and I am the CEO and co-founder of Intellijoint Surgical. Intellijoint Surgical is a medical technology scale-up that develops and commercializes, surgical navigation solutions for total joint replacements. We are committed to improving patients' lives by providing every surgeon with effective, easy-to-use technology. Intellijoint's flagship product, Intellijoint Hip, provides surgeons with real-time intraoperative measurements to ensure accurate positioning of orthopedic implants during total hip replacements. Since founding Intellijoint Surgical in 2010 with Andre Hiladio and Richard Fanson, it has been our dream to grow from an engineering design project to a successful medical technology company. Moreover, it was our vision to keep Intellijoint Surgical Canadian, and even more specifically, to keep our headquarters here in the Waterloo region. There is something unique about our region, which is filled with incredible young talent, opportunity, and a strong sense of community. Even though none of us are from the region, we have planted our family roots here, and we now call Waterloo Region home. As a young startup leaving the Accelerator Center back in 2013, it felt that there were new roadblocks for us at every turn. Not only do medtech startups face similar challenges to any venture, such as the need to recruit top talent and manage a business without a lot of capital, we must also conquer the specific challenges faced by both high-tech manufacturing and pharmaceutical companies. For example, we need to build physical prototypes, we need to secure intellectual property, and ensure compliance with regulators. Thankfully, through some amazing mentors, some friendly experts, and the key ingredient, grit, we were able to see that the traditional goal of acquisition isn't the only fate for Canadian medical technology companies. We commercialized Intellijoint Hip in 2016 and celebrated our 10,000th successful paid surgery only 3 years later. Today, I am proud to share the realization of another dream with you. The first of its kind in Canada, MIX is an industry-led incubator hub dedicated to helping medical technology startups scale successfully in Canada. MIX was created to reduce the barriers and bridge the resource gap facing medical technology startups, contribute to building a strong medical ecosystem, and simply put, pay it forward. We will do this with 3 major activities. Firstly, by connecting and uniting the medical community locally, nationally, and globally. Secondly, by providing access to a shared state-of-the-art lab, manufacturing facilities, and collaborative office space. And lastly, by providing tailored mentorship and networks and facilitating essential business partnerships. Already, MIX has 3 high-potential residents. Bloom is a digital health technology and services company that easily connects patients with healthcare professionals in the home and community care sector. Bloom is the winner of the Health Technology Fund, awarded by Ontario Centres of Excellence, Chief Health Innovation Strategist, and Ministry of Health and Long-Term Care. And they are currently working with health authorities, hospitals, and health service providers to provide better transitional care from hospital to home. Penta Medical has developed an innovative solution for injury management. They work with sports medicine doctors and physiotherapists to help reduce injury rates and track and monitor patients' recovery to catch complications sooner and improve outcomes. Vena Medical is the 2019 winner of Sunnybrook's Next Generation Hawk's Nest. They have created a forward-viewing imaging microcatheter that was used in a successful animal study at the Texas Heart Institute's Cardiovascular Research Lab with world-renowned Dr. Billy Cohn. They attended the TMCX Accelerator and Y Combinator, and we are thrilled to have them back in Canada. We are excited to announce that earlier today, we released a call for applications for a spring 2020 residency and look forward to the addition of more residents to the MIX community. We hope that through the creation of MIX, many more Canadian medtech startups will realize their own dream of commercializing their innovations, ultimately leading to a thriving ecosystem which strengthens our economy, benefits Canadian patients, and establishes the Waterloo region as a leader of medical innovation. We are pleased today to have Kitchener Mayor Barry Vrbanovic with us. Please join me in congratulating Barry on his 25 years of service to the City of Kitchener as an elected official and serving as our city's mayor since 2014. Our mayor is an invaluable partner for the technology community, and his tireless efforts have been an essential catalyst for putting Kitchener on the map for innovation. I had the pleasure of showing Mayor Vrbanovic the mixed space before the holidays and was enthused by our conversation and the opportunity for collaboration to strengthen Mix's infrastructure to further support scaling companies within the region. Please join me in welcoming Mayor Vrbanovic for today's opening remarks.
Well, thank you very much, Armen, for those very gracious comments, and it really is a pleasure to be here with all of you to celebrate the opening of Mix. And I see I'm joined by a number of elected officials who are here in the room as well, including Councillors Sarah Marsh and Mark Johnson from Kitchener City Council. Former Mayor Carl Zaire, who I have to give much kudos to because he certainly started the whole process of bringing tech and innovation into the core of the city. I see Mayor Dave Jaworski is here, and two of our MPs, Raj Saini and Tim Lewis, are here as well. And I see Brian Bennett from our economic development area who is here. So from the City of Kitchener's perspective, it really is a pleasure to congratulate you, Armen, and the team on making Mix a reality. I first heard about Mix, or the concept behind Mix, a while ago. And you might be surprised to hear it wasn't actually from Armen himself initially. In fact, it was about a year and a half ago. I had a little bit of a stage accident, had my elbow replaced, and I was getting tortured at a physio session where my physiotherapist was telling me about this great vision that he had heard about of getting a medical incubator happening in the City of Kitchener. And I said, you know what? I said, I think I've heard about this, but we've got a meeting scheduled in the next few weeks, so maybe I'll learn more as when that meeting happens. And that was when Armen first met with myself and a number of people at the city to talk about the idea. And I think what's really exciting is to see how it took a little bit of time. It brought the right partners together, and ultimately we're here today where a great vision coupled with a little bit of extra space from Christie Digital has made this facility become a reality, and a number of companies, as Armen has said, have located here to bring the concept to life and get it going. Now, what's really interesting is during this same time period, there's been a dialogue that started in the community about the future of healthcare in our community, and this whole notion of hospital care and what that should look like, and should we have a teaching hospital ultimately in the long run in the community. And one of the things that's really being thrown around and talked about is, do we really need a teaching hospital? In fact, what this community is known for is innovation and a different approach to things. And in fact, the future of healthcare and innovation in healthcare will come by not doing more of the same, but actually doing things differently. And I think Mix, and I think that dialogue and exploring how that discussion around the future of healthcare for our community, but ultimately how that will impact the province and the country. If there's any place in the country where that can be done differently, it's right here in Waterloo region. And so, Armen, I do congratulate you on behalf of all of us on council. We're thrilled to have you here. As I said to your parents, thank you for sharing him with our community, and thank you to all of the partners that have become part of what I know is going to become a great success story, and we'll see Waterloo region. And I'm the mayor of Kitchener after all, and Kitchener get on the map in terms of healthcare and medical innovation going forward. And with that, I do have a little certificate to give you on the occasion of your grand opening. And it says, the council and citizens of the city of Kitchener extend congratulations to Mix on the occasion of your grand opening celebrated this day. Congratulations as you celebrate your new space to house the first of its kind in Canada, a medical tech hub. We recognize Mix as being a leader and forerunner in its mandate and wish you every success for years to come. And if I can ask Councillors Marsh and Johnson to come up and join me as I present it to you, that would be great.
Excellent. Here we go. Just give me a few. Thank you. Maybe 40 more. Here we go. Excellent. Good job. Perfect. Thank you.
Good. Oh, one more.
Oh, sorry. We have one more. One or two more.
Thank you. There you go.
Thank you.
Thanks. Congrats.
Thank you, Barry, and thank you so much for the recognition. That's not what we do it for, but we genuinely appreciate it. I had the absolute pleasure of first meeting our keynote speaker during his tenure as the Deputy Minister of Health and working alongside him as members of the Health and Bioscience Economic Strategy Table for the Federal Government of Canada. In the fall of 2019, Simon Kennedy moved to his latest appointment as Deputy Minister of Innovation, Science and Economic Development. He has been a champion for Canadian medtech and an advocate for the health of Canadians. He understands the challenges that startups face and isn't afraid to roll up his sleeves to get the hard work done to create a solution that supports the growth of scaling technology companies in Canada. Please join me in welcoming our keynote speaker, Mr. Simon Kennedy.
Thanks a lot, Armen. I'm really humbled actually to have been asked to talk today, partly because I feel like every time Armen and I had a conversation, it was always about some problem that needed to be fixed. So I never felt like I was bringing all kinds of exciting solutions. I was more to trying to lowering my head and saying, okay, we'll get to work to see if we can't deal with that issue. Alors, c'est un plaisir pour moi d'être ici avec vous tous aujourd'hui pour cet événement très spécial. I'd like to acknowledge the dignitaries in the room today, and as I say, I'm very, very happy to join you all. As some of you may know, and Armen had just mentioned, I did serve as the Deputy Minister at Health Canada for about 4.5 years. And in that role, I saw firsthand how the healthcare sector has been profoundly changed as a result of innovation. And I have also seen how government collaboration with the industry can create better outcomes on all sides in times of fundamental change. So I think we're all challenged to find ways to work better together to produce better results for Canadians. During my time at Health Canada, we actually spent a lot of time trying to renovate how we regulate therapeutic products, both drugs and medical devices, because the pace of change is so relentless. And if we look, kind of pull the lens out a little bit more broadly, Canada's economic outlook is generally pretty good. Our macroeconomic performance has been solid. We've had GDP growth, but the global economy is undergoing a significant transition, and one that we believe is redefining what it means for Canada to be competitive in the 21st century. And as with all major economies, there are new opportunities, pretty exciting opportunities actually on the horizon, but also some headwinds and some real challenges we have to face. We are a nation of traders. We depend on access to world markets for our prosperity. Canada is the first G7 country to have negotiated trade agreements with the three most important economic regions of the world, the EU, North America, and the Asia-Pacific region. But globally, growth is slowing. There are new challenges to commerce. I don't need to talk in detail about that. And there is increased competition to control an ever-increasing size of global market share, particularly in emerging industries such as artificial intelligence. And Canada is not immune to these global pressures. Our population is aging. It's aging quickly, and in that respect, we're not unique either. For the first time in its history, Canada, and in fact other Western economies as well, have more people over the age of 65 than those under 15. That means we can no longer rely on population expansion as a means to fuel growth. It's really interesting when you look at the statistics to see just what portion of our growth in the economy over the last 30 years was actually just driven by adding new people every year. An aging society will mean fewer workers comprising a proportion of the population. Already, businesses across all regions of Canada are finding it harder to get the workers they need. To mitigate the impacts of an aging society, governments and business alike need to look at reskilling and upskilling workers to take advantage of the latest productivity-enhancing technologies. Innovation is going to be really important for the growth of the economy in the future. We cannot just rely on the sheer number of people actually active out there in our society. Climate change and environmental issues are also a major issue we need to consider. There's a lot of work going on to make Canada a world leader in clean and sustainable practices, as well as new clean technology. This is an opportunity. It is also a big challenge. And for our businesses to thrive in the future, it's something we're going to have to work through. And one of the last big changes is around the issue of data and the harnessing of data and data analytics and the adoption of data-enabled technologies. The digital economy is changing how business gets done across the globe. That's as true in the medical device sector as it is in virtually every other sector of the economy. If you look at the S&P 500, important measure of the stock market, 90% of the value of the S&P 500 is in intangibles. So most of the value, the market cap of the stock market is actually consists of things that don't actually physically exist. It's about ideas, it's about knowledge, it's about IP, and we talked a bit about that earlier. Advances in data analytics, automation, machine learning, they are transforming how we work, how consumers interact with businesses, how we live. That is giving Canadians access to new and improved services. It's giving consumers choice, in some respects unprecedented choice. It's now just a click away to get virtually any product or service you may want. It has the potential to bring people together all across the country. But those very same technologies that are breaking down barriers and creating opportunities means we can't be complacent as the global economy changes and we have countries seeking to capitalize on new business models and new ways of operating. And Canadians, and this was obviously something that came up during the electoral campaign, but there are issues around trust, about how their personal information is being used, about how privacy is protected, about the use of data. So the government has been doing a lot of work to try to support Canadians in dealing with these issues. The government has been advancing a new whole-of-government approach to innovation policy that is based on greater collaboration with industry, on research with research institutes, civil society, and others. It has worked to develop partnership strategies for high-growth sectors such as health and biosciences, and to build industry ecosystems through, for example, the Supercluster program. Armen had mentioned, but I was very pleased to work with him and other colleagues in the health and biosciences industry on the Health and Biosciences Economic Strategy Table. This is a round table designed to bring together CEOs from across the health and biosciences industry, together with government officials, to talk about how we work together to try to overcome some of the barriers to success in this sector. The government has taken steps to spur innovation through the Strategic Innovation Fund, of which one stream was dedicated to increasing collaboration between the private sector, researchers, and other nonprofit organizations to advance industrial research, development, and technology demonstration. So we have new tools, many new tools actually in the last few years, to partner with the business sector, to work with researchers, and to try to take advantage of innovation. Finally, the government has taken action to define new rules for the digital economy with a new digital charter to act as a guide for Canadians and Canadian business in the digital economy. And one of my focuses is going to be working over the next couple of years to kind of implement the digital charter and bring new rules to the fore on how we actually operate in a digital economy. So all of that means that Canada stands at a defining moment. We are in a period of uncertainty and risk, that's true, but also one of immense possibility. And to succeed in ushering in a new era of Canadian global competitiveness will require a continued commitment to working with business, to evolving our business support systems as governments, and to encouraging and working to ensure a thriving, innovation-based marketplace. Now, if you look at health, health is a key social program. It's one we all cherish. It's something that defines us as a country. We're all very happy to be in a country where, if you get seriously ill, you don't have to, mortgage your house in order to ensure that you can deal with your illness. But it is also an important part of the economy. We talked about this earlier. Almost $1 in 10 that circulates in the economy has some attachment to healthcare. And costs are rising. An aging society brings new costs. There is huge opportunities to reduce costs, to improve care, while supporting Canadian firms. That's what innovation in healthcare is all about. From my time at Health Canada, I saw the convergence of technologies, especially around things such as machine learning, new digital applications that are forging a whole new age in medical discoveries and treatments. They're also shifting the line between what we would have considered traditional product categories for regulatory approval. So we had to actually start re-engineering how the government actually oversees this sector. Today, novel drugs are being delivered in combination with advanced medical devices as an integrated product. So how do we regulate it, as a drug or as a medical device? It's kind of both. That challenges people in government to apply regulatory frameworks that are more flexible, that actually are better suited to today's realities. Medical devices are also becoming much more innovative, and Armen and his colleagues know all about that. We are seeing more medical devices that take advantage of new technologies such as 3D printing, medical devices that come with advanced software, even medical devices now increasingly using machine learning, to the point where you have a device that might be implantable, and over time the device learns about you and actually calibrates to be very specific to your own body. And in fact, we set up a new division when I was at Health Canada specifically to deal with these kinds of trends. Regulators, as I mentioned, are working to provide better regulatory pathways to approve emerging innovations and products. And that way, regulation is perhaps a way to strengthen innovation. There is also work going on to bring innovation into the healthcare system itself, to look at new management models. We talked a little bit about procurement earlier. All of those things are really important, and we as government have to keep working on that. Initiatives such as the Medical Innovation Xchange can play a really important role in nurturing our best new medical innovators to bring new ideas to market. There are things government can do, but the mentorship, the kind of demonstration, the camaraderie, the learning that can take place in organizations like MIX is really essential. And I just want to congratulate Armen, Caitlin, and their colleagues for their foresight in establishing this facility. It was a real privilege to be invited to participate today. This has been a labor of love, Armen, for you and your colleagues. I think it represents the best of our entrepreneurs in this country, that they're not only trying to build businesses to provide for themselves and their family, they're also trying to build a better country. So congratulations on today's opening. I look forward to working with everyone in this room and making the changes we want to see for our future, including in healthcare, to continue to innovate, drive change, and push the limits of what we can accomplish together. Thanks again for having me here today.
Thank you so much, Mr. Kennedy, for those great remarks. I also want to take a second to thank Minister Chagger that was here earlier today during our roundtable. And thank you to everybody who is in the room today for being here, for supporting our vision of a thriving ecosystem that develops, sustains, and retains local medical technology companies and establishes Waterloo Region as a leader of medical innovation. Thank you to the team that helped put this event together today. It's an amazing event, and I'm very thankful. Caitlin, who is here and is our MIX community manager, was instrumental in making MIX a reality and making the event a reality, as well as Rebecca, Allison, and Yami from Intellijoint Surgical. I want to thank Angela from Bar Pilot and our vendors, including Bike Catering, Sherwood AV, and Brandon Marsh Photography. Today's grand opening is only the beginning. As has been identified in discussions that we had with various advisors here in the room, including Mr. Kennedy, Adrian, and others from the medtech community, we are dealing with an exodus of Canadian medtech companies leaving to access funding, customers, and commercial talent south of the border, or accepting early acquisition by a large multinational as the only exit option. By allowing this to continue, we are clear-cutting our budding trees or transplanting them before we have a forest. We are depriving our country of economic growth and Canadian patients from accessing homegrown innovation. Solutions that have been vocalized today to help retain medtech startups include aligning with the right investors, developing an intellectual property strategy early on, viewing foreign multinationals in a different light, and as every Canadian, asking for better and demanding for better. I challenge everyone in the room today to think about what they can do to influence change, to affect a strategy from being one that requires multinational involvement to grow our economy, to one where domestic startups can become scale-ups to create a strong and prosperous medtech ecosystem. Canada is known globally for its research institutions and innovation, yet we rarely see the development of this research stay within our borders. Let's continue the conversation outside this physical space and within the community to identify what is needed for medtech leaders, academics, investors, government officials, and healthcare systems to evoke change and create a flourishing and growing ecosystem of domestic medtech. An ecosystem we can be proud of, where Canadian medical technology businesses can start here, can stay here, and can scale here. So I'd like to invite Mayor Vrbanovic, Mayor Jaworski, Sarah Marsh, Simon Kennedy, Raj Saini, Tim Lewis, Alexa, Michael and Ben, it's a full list, to join me on stage for the ribbon cutting ceremony. It's actually going to be a fake ribbon cutting ceremony. Oh, never mind.
I think we will.
It's allowed. We can actually cut the ribbon. Excellent. So after this, I'd like to invite everybody to mix and mingle, pun intended. We have refreshments in the bistro, and we'll be giving building tours and product demonstrations until 5 p.m. If you are interested, tours will leave every 10 minutes, starting at 4:20, if that time is still accurate, just from outside the bistro. So thank you so much. Go. Be safe.
I'm just wondering, should we take our tags off?
Yeah, tags off.
Yeah, thank you. I want to see your face. I just want to make sure, I did weddings so I can't have any hiders, so. Everyone a little bit this way, and then we'll just get these two young ladies in, right up here. Excellent. Okay, come a little more. So we'll do my first 40 tests, and then we'll get it. I mean, this is what we do in the medical industry, right? Okay, excellent. All right, I love that mixed smiles. Here we go. And there's a couple of us to take pictures, so don't run anywhere. Good. Thank you very much. Good. Come on up a little bit there, dear. Good. Excellent. And here we go. Okay, you want to take a couple, and we'll get the cut together. How's that? All right. So we'll let them warm up. Oh, sorry. I'm never in the picture. I'm just going to make one change here. Wait, hold on. Looking up when you're doing this. Okay. Okay. All right. 1, 2, 3. Looking here. There we go. Good.